The abortion debate was front and center here today, an argument in the State House over what doctors should tell patients about ultrasounds.
The information we're offering to women in this bill is a picture, and some women would really appreciate that picture.
Republican Abigail Whalen carried a bill that would require doctors to inform abortion patients they have a right to view an ultrasound before moving ahead with the operation. It's already standard policy at Planned Parenthood, but Whalen argued it doesn't always happen.
Is that there are women who have asked to see their ultrasound and they were told no.
What the Minnesota legislature is saying is that women do not know their minds, and women do not know their hearts, and that women do not know their bodies.
The bill passed, and it's already passed the Senate, so now it's headed to Governor Dayton for either a signature or a veto. Now, in other news today, the Senate debated a bill that would ask pharmaceutical companies to pay for part of the cost of opioid addiction treatment.
I just find it a little offensive when I step outside these walls and I cannot get the pharmaceutical manufacturers and distributors engaged in this conversation.
Republican Senator Julie Rosen's opioid stewardship bill would boost licensing fees for companies that sell prescription opioids in Minnesota, collecting $20 million for treatment programs.
They're so doggone cocky and confident that their arrogance just smells. They aren't afraid, because they know they've got us beat before we start.
There were only 6 no votes. Now, Senator Rosen's bill is an alternative to Governor Dayton's proposed penny a pill tax, and Dayton also supports the Rosen bill. The question is whether it can get through the House of Representatives. From the Capitol, I'm John Croman.